Hi, today we'll talk about the maxillary nerve, which is a branch of trigeminal fifth cranial nerve. Let's talk about it. Okay. Here it's a midbrain, pons, medulla. This is a nucleus, main motor nucleus. This is a mesencephalic nucleus. Okay, and down is a spinal nucleus. Okay, so this is outline for the face. This is the cavernous sinus, and this is the pterygopalatine fossa, in which the pterygopalatine ganglion will be there. This is pterygopalatine fossa. This is maxilla. This is orbit. Okay, and this is foramen ovale. This is foramen rotundum. Here there is a trigeminal ganglion, which is a sensory ganglion, which is sitting on the petrous part of the temporal bone. Okay, this is the petrous part of the temporal bone, this side, in the middle cranial fossa. Okay, here there will be the posterior cranial fossa through which this is coming. This is the middle cranial fossa. This is the anterior cranial fossa. This is middle cranial fossa. This trigeminal ganglion is the sensory ganglion. This is the principal pontine nucleus, mesencephalic, spinal part of the trigeminal nucleus. Pain and temperature fibers are coming from, they are going to the spinal nucleus of the trigeminal ganglion. Fine touch fibers from face, nose, mucosa, palate, etc. They go to the principal pontine nucleus. This principal pontine nucleus will get fine touch, pain, temperature here. Okay, and this is the sensory fibers of the mastication. They will go to the mesencephalic nucleus. Okay, here from the trigeminal ganglion there will be ophthalmic nerve, okay, maxillary nerve, and mandibular nerve. Okay, the mandibular nerve, I have this foramen ovale. Through foramen ovale, this mandibular nerve will go down, and this maxillary nerve will go here, and this ophthalmic also. So this maxillary nerve moves through the lateral wall of the cavernous sinus. Okay, this is cavernous sinus. This is middle cranial fossa. Okay, so it is going to the lateral wall of the cavernous sinus, and it reaches and it leaves the. I have made it little upwards. It is very down, and it's very close to the foramen rotundum. So as the maxillary nerve passes through the lateral wall, and then it leaves the cavernous sinus and directly enters into the foramen rotundum. Okay, then it enters the foramen rotundum. Through foramen rotundum, it enters the pterygopalatine fossa. This is pterygopalatine fossa. Okay, and this foramen rotundum is a communication between this middle cranial fossa and the pterygopalatine fossa. Okay, and this middle cranial fossa, if you talk about its position, this is orbit. Okay, it is below the posterior end. This is the posterior end of the orbit. This is the posterior end, and it is below the posterior end of the orbit. It is behind the maxilla. This maxilla, it is behind the maxilla, and this is middle cranial fossa. So it is anterior to the middle cranial fossa, but inferior. So it is antero-inferior to the middle cranial fossa. This pterygopalatine fossa. Okay. In the pterygopalatine fossa, there is a ganglion. Okay, this is known as pterygopalatine ganglion. Okay. So it, and like this, it goes to the pterygopalatine ganglion, and then this is an orbit, and here there will be infraorbital fissure. Okay, this is infraorbital in this orbit, so it's infraorbit. This fissure is known as infraorbit fissure, and from here it enters the floor of the orbit. Okay, like this. It is this is a fissure which is a connection between the pterygopalatine fossa and orbit. So this is what this is, infraorbital fissure. Through this fissure it enters the orbit, and then it moves like this. Firstly it is like moving through the infraorbital groove, and then this groove becomes a canal. Okay, so firstly this nerve which is passing through this infraorbital groove, and infraorbital canal is known as infraorbital nerve. Okay, this maxillary nerve enters the infraorbital fissure. Through infraorbital fissure enters the orbit floor, and then goes through the infraorbital groove, and then through the infraorbital canal, and this is known as infraorbital nerve. Okay, then this infraorbital canal at the end opens into infraorbital foramen. Okay, this was infraorbital fissure, and this is infraorbital foramen. Through it comes out. From here, few fibers go to the upper, that is palpebral branch, that is to the upper eyelid. It goes, some goes to the nose, some fibers go to the upper lip, superior labial, nasal, and palpebral branches. These are nasal branches, palpebral branches, and superior labial branches. These are the endings of this maxillary nerve. Then while it is coming from here till here, it gives many branches. What are those branches? Let's talk about it. So as it is going, I have shown you a lot of space over here just for the clarity, but it is not so empty over here. This cavernous sinus is a little down. They are very little, because this is on the middle cranial fossa. Okay, so it's very close. So this maxillary nerve over here, this gives from here, it's very close. Okay, it gives here meningeal branch to the bone. Okay, it supplies the middle cranial fossa. This meningeal branch supplies the middle cranial fossa, and then while it is passing through this pterygopalatine fossa, it gives ganglionic branches to pterygopalatine ganglion. These blue one are the ganglionic branches. This is meningeal branch, this is ganglionic branch, and this is moving like this. This is a maxillary nerve which is moving, and these are the ganglionic branches. Okay, which is supplying the pterygopalatine ganglion. From here, some fibers relay, some do not relay, and then they go to the destination. Okay, maxillary nerve gives sensory input to the pterygopalatine ganglion. It gives sensory input like this, and then they go through the branches of this ganglion to the places where they want to their destination. Okay, and from here there is like this. From here it is zygomatic branch. This is zygomatic branch from the maxillary nerve. This zygomatic branch, it goes like it divides into two. Here is zygomatico-facial foramen. Here is zygomatico-temporal foramen. Okay, then a branch, this is zygomatico-temporal, this is zygomatico-facial. Okay, then a branch from zygomatico-temporal nerve goes along with the lacrimal nerve. You know, lacrimal nerve, that is a branch of ophthalmic nerve. So this black one is the branch to the lacrimal gland. This is a lacrimal gland. Okay, so a branch from zygomatico-temporal nerve. This is zygomatico-temporal nerve, zygomatico-facial nerve. This is zygomatico nerve. Zygomatico nerve is a branch of maxillary nerve. Okay, from here there is one more branch from maxillary nerve. This is posterior, because it's posterior, it's superior, coming from superior. It is posterior superior alveolar branch. Posterior superior alveolar branch. Okay, it moves laterally, okay, downwards on the lateral wall, and it is behind the maxilla and ahead of pterygoid bone. This area is called pterygomaxillary fissure. The area between these two bones is the pterygomaxillary fissure. It goes downwards, and in maxilla it supplies the molars. Okay, it is a superior branch coming to the jaw. It is a posterior branch. Okay, and like this is pterygomaxillary fissure. So this branch firstly travels through here. Firstly it travels all the way here, and then it enters the maxilla and supplies the premolars. Okay, so I have made a little wrong, because as it is coming, I'll make with a black. It is coming like this, and then from here it enters, and then it supplies, because this is a pterygomaxillary, because we have a root over the pterygomaxillary fissure. Okay, it comes in pterygomaxillary fissure, and then okay. Then there is one more branch also. There is in this alveolar, this maxilla only it supplies. It is a middle superior alveolar. From this, from here only there is a branch which is supplying. This is middle superior alveolar branch. Okay, middle superior alveolar. So how many direct branches we have done till now? Once again, meningeal, ganglionic, zygomatic, orbital, these alveolar, and which is left? Meningeal, zygomatic, alveolar, posterior superior alveolar. Not all alveolar. Why? Because this posterior superior alveolar is directly coming from the maxillary nerve, but this middle and anterior superior alveolar is coming through this one branch of this is the infraorbital nerve. This is not the maxillary nerve. This is the infraorbital nerve, which is a branch of the maxillary nerve, and this posterior superior alveolar is directly coming from the maxillary nerve. Okay, so it's a direct branch. Ganglionic is a direct branch, meningeal is a direct branch, and this zygomatic is also a direct branch because it is coming from this this red line. Red line is a maxillary nerve. Okay, and orbital is also a direct branch of the maxillary nerve. Then there are indirect branches also. What are indirect branches? Indirect branches are which are going through the pterygopalatine ganglion to the tissues. Okay. For example, there was a median nerve over here. The median nerve consisted of sympathetic fibers. Okay, they also come here. They come here and then they go the sympathetic fibers. Okay. Parasympathetic were also there in the median nerve. So there are parasympathetic fibers, postganglionic parasympathetic fibers. So this was about maxillary nerve. If you have any doubts, please let me know. Thank you.